To understand COVID-19, we need to first understand what coronaviruses are. Coronaviruses are a large family of viruses that cause respiratory illness ranging from common cold to more severe diseases such as MERS or SARS. The term coronavirus comes from their crown-like microscopic appearance. COVID-19 stands for Coronavirus Disease 2019, and it is an acute respiratory illness caused by a new strain of coronavirus. The symptoms of COVID-19 include fever, cough, sore throat, muscle aches, and breathlessness. Transmission of COVID-19 is thought to be similar to that of other respiratory illnesses. Respiratory viruses are usually transmitted from person to person through droplets which are generated when an infected person coughs or sneezes. These droplets typically travel up to 2 meters in distance. The disease can be transmitted if these droplets come into direct contact with another person nearby, such as when someone sneezes or coughs around others. The disease can also be transmitted if the droplets contaminate a surface or an object, and that contaminated surface is then touched by another person. By taking the necessary precautions, you can reduce the risk of potentially catching or spreading the virus to others. First, you should practice good personal hygiene and take care of your own health. Wash your hands regularly. Avoid touching your face with your hands. Monitor your temperature and maintain a clean environment by regularly disinfecting surfaces. When washing your hands, be sure to use soap and ensure that you cover the back of your hands, in between your fingers, as well as your fingernails. Second, if you are unwell with flu-like symptoms, take measures to protect yourself and those around you. Wear a mask to reduce the risk of spreading infection to others. If you don't have a mask, cover your face when you cough or sneeze. Do not go to work or social gatherings when you are unwell. Instead, consult a doctor to get appropriate advice. When looking for a doctor, you may wish to consider the option of teleconsultation. For instance, you may wish to use the White Coat telemedicine service, which is available to all AIA Health Shield Gold Max customers. In doing so, you reduce the number of people you come into contact with, which helps to reduce the risk of spread. Third, keep informed. Keep yourself updated on the official advice coming from the government or from reputable news sources. If you are in the workplace, ensure that you are familiar with your organization's business continuity plan. Do not rely on information from unofficial sources or stories spread on social media. Fourth, if you are a close contact of someone who has developed COVID-19 or have recently returned from mainland China yourself, please remain under quarantine and monitor your health closely for 14 days. At AIA Singapore, the health and well-being of our employees, representatives, customers, and the wider community is our utmost priority. Our integrated shield plan, AIA Health Shield Gold Max, covers pre- and post-hospitalization medical costs on top of the hospitalization expenses related to COVID-19. AIA's hospital income plan also provides a cash payout for each day the insured is hospitalized should they test positive for COVID-19. To provide additional assurance during this period, we will be giving customers, AIA employees, and tied representatives free additional COVID-19 coverage. This includes a $1,000 lump sum pay on hospitalization and payout for death due to COVID-19. We will be covering more than 1.4 million people through this, and more information can be found on AIA Singapore's corporate website. Finally, in the event of any claims related to COVID-19, AIA Singapore will provide dedicated and expedited support. COVID-19 represents a challenge for our community, but it is one that we can overcome together. It is important that we remain calm, maintain good personal hygiene, and take appropriate precautionary measures when sick. As a company, AIA Singapore is committed to protecting our customers in good times and in bad, and we will do what we can to ensure that our stakeholders are supported during this period. Thank you and stay safe.